Telemedicine, a hit solution important to healthcare delivery. By Group 2, Alicia Fisher, Larry Bird, Bernard Garcia, and Makita Bird.
Good evening, everyone. I'm Alicia, and this is my presentation on a brief history of telemedicine. Telemedicine has been around for almost 4 decades. It is one of the earliest examples of an electronic medical consultation, which is a telephone conversation between two doctors. Telemedicine was originally created as a way to treat patients who were located in remote places that were far from local health facilities or in areas with a shortage of physicians. Telemedicine is simply defined as the means of sending information over a distance in the form of electromagnetic signals. And the best example that I can share of the earliest form of telemedicine is Life Alert. And Life Alert is wirelessly connected to a base console unit. So when a senior citizen pushes the button on their necklace or wristband, it automatically connects them to an emergency response center for immediate help. Through video teleconferencing or VTC, physicians are able to perform routine care such as listening to the lungs or the heartbeat, checking the eyes, ears, nose, and throat with the use of special instruments. AMD Global Telemedicine Incorporated, located in Chelmsford, Massachusetts, offers software-embedded medical instruments such as otoscopes, stethoscopes, dermoscopes, ultrasound probes, as well as vital signs monitors, sphygmomanometers, electrocardiography, or ECG equipment that allows split-screen viewing between the camera and the medical devices. Through the evolution of telemedicine, several specialties have evolved in different categories: telenurse, teleradio, telepathology, and teledermatology. The goal of telenursing is to create a 24-hour healthcare service through registered and advanced nurse practitioners to assist patients living in remote areas or patients that are immobilized and are able to come to facilities. With this telenursing, these nurses, they answer any questions or concerns that a patient may have about a diagnosis or caring for a wound after a surgery, or anything along those lines. And all this is done through the use of a video phone or video conferencing. Teleradiology is basically creating and transmitting medical images. For example, that would be your x-rays as well as your CT scans. Telepathology is the transfer of pathology data between location for the purpose of medical diagnosis, medical education, and of course medical research. One of the most common applications of telemedicine as well as e-health is teledermatology. Teledermatology is the exchange of medical information concerning the skin for a medical diagnosis. With the advancement in technology, patients' attitude toward telemedicine have been positive because patients love the convenient medical care. It's less time in the waiting rooms. It's more accessible for those individuals who live in rural and remote areas. It reduces healthcare costs drastically, and it also decreases the spread of infectious diseases. To conclude my presentation, the modernization of medicine through the use of telemedicine has enhanced patients' understanding and maintenance of their own health care. This technical innovation has allowed healthcare professionals to modernize the way they practice and approach medicine. I'm Alicia Fisher, and this has been my brief history on telemedicine. Thank you so much for listening.
Types of Telemedicine, presented by Larry Bird. Types of telemedicine. Telemedicine refers to the delivery of clinical service that patients receive from a distance. The practice of telemedicine is largely broken down into 3 types of solutions. 1. Store and forward. 2. Remote patient monitoring. And 3. Real-time encounters. Telemedicine gives healthcare providers another way to deliver effective and efficient care to patients. For patients, it provides a more convenient way to get the care they need. Store and forward. Store and forward telemedicine is an effective way for patients, primary care providers, and specialists to collaborate because they can all review the information when it is convenient for them. It gives patients access to a care team that can be comprised of providers in different locations, even across long distances and in different time zones. It allows healthcare providers to gain access to patients' medical data such as records, lab results, images, and videos. Remote patient monitoring. Remote patient monitoring is also known as telehealth or telemonitoring. Remote patient monitoring allows healthcare professionals to track patients' vital signs and activities from a distance. This type of monitoring is often used for the management of high-risk patients, such as patients with heart conditions, patients with diabetes, and patients who have recently been released from the hospital. It can also monitor patients who are recovering from surgery while at home. Remote patient monitoring offers healthcare professionals the best way to receive health updates that may require quick intervention. Real-time encounters. Real-time encounter gives an alternative option to in-person visits for patients and doctors. It involves a live stream interaction between patients and their doctors by using audio and video communication. It is important to know that video communication applications like FaceTime and Skype are not appropriate for telemedicine. Telemedicine real-time encounter is conducted using technology that has been designed to protect patients' privacy and meet the requirements of Health Insurance Portability and Accountability Act (HIPAA). For patients to utilize real-time encounter with a doctor, the patient needs to have a computing device such as desktop PC, laptop, smartphone, or tablet. The solutions of telemedicine in the healthcare industry. Telemedicine provides solutions in the healthcare industry by sharing patients' medical data to various doctors and specialists instantaneously. Patients' diagnosis can be received much faster and more accurate. Patients have less wait times, better optimization of doctor's time, and better patient outcomes. Patients can remain in close and convenient contact with their healthcare professionals, which is extremely important for doctors who can monitor changes in patients' health status with great accuracy. It also gives patients the convenience of not being forced to visit doctors in person and boosting work-life balance.
Hello, this is Bernard Garcia, and my part of the presentation is to talk about the pros and cons of telemedicine. Pros of telemedicine. What are the advantages? Adopting the latest telemedicine initiatives can help any practice achieve numerous benefits. You can lower healthcare costs drive up practice efficiency and revenue, provide your patients better access to healthcare services, and ultimately get happier, healthier patients who will stay in your practice. In today's healthcare world, convenience is key. Adding telehealth to your practice offers patients simple, on-demand care without the usual wasted time and cost of most in-person visits. Patients who live in remote locations or who are homebound or just can't take time off from work can easily access care virtually. Video conferencing, smartphone apps, and online management systems connect more patients with providers than ever before. With telemedicine, patients in rural or remote areas benefit from quicker and more convenient specialist access. In the U.S., for every 100,000 rural patients, there are only 43 specialists available. These patients endure longer appointment commutes and have trouble accessing life-saving consultations for specific diseases or chronic care plans. Telemedicines offer better access to more specialists. You can refer your patients to specific physicians they need regardless of their location. Or if you're a specialist looking to expand your patient population, telemedicine can help you reach a wider geographic region. Remote analysis and monitoring services and electronic data storage significantly reduce healthcare service costs, saving money for you, your patients, and the insurance companies. Telemedicine also reduces unnecessary non-urgent ER visits and eliminates transportation expenses for regular checkups. Recently, the American Hospital Association reported on telemedicine program that saved 11% in cost and more than tripled the return on investment for investors. Beyond these general cost savings, telehealth can help boost doctors' revenue by turning on-call hours into billable time, attracting new patients, reducing no-shows, and even reducing overhead for physicians who decided to switch to a flexible work-from-home model as part of their week. When patients are committed to their own healthcare goals, it leads to lower costs and improved health. Ernst & Young Senior Advisory Service Manager Jan Ollenberg told Healthcare IT News that the high cost of disengaged consumers affects everybody. Engaging your patients through telemedicine can help them maintain appointments and care schedules. Increased engagement initiatives can also curb obesity rates and tobacco use by helping you encourage your patients' healthy lifestyle choices. Not only do virtual visits reassure patients that their doctors are available and involved in their care, it makes it much easier for them to reach out to with questions, report early warning signs, and make follow-up appointments to make sure that you're on track. Telemedicine offers patient-centered approaches, such as improved timeliness of care. This is critical to quality patient care. Patients can address healthcare issues quickly with real-time urgent care consultations and learn about the treatment options within minutes. A new study shows that telemedicine patients score lower for depression, anxiety, and stress and have 38% fewer hospital admission. Now let's take a look at the cons of telemedicine. What are the disadvantages? While telemedicine promises to grow rapidly over the next decade and has clear benefits, it still poses some technical and practical problems for healthcare providers. Restructuring IT staff responsibilities and purchasing equipment takes time and costs money. Training is crucial to building an effective telemedicine program. Physicians, practice managers, and other medical staff needs to be trained on the new systems to ensure that the solid return on investment. In addition, your staffing requirements may decrease. For instance, a nurse in rural Alaska facility can monitor up 33 patients at once from a single location using a telemedicine services. In cases where patients are using on-demand telemedicine services that connect them with random healthcare provider, care continuity suffers. Patient's primary care provider may not have access to records from other visits and end up with an incomplete history for the patients. Service provider shuffling increases the risk that the doctor won't know a patient's history or have notes about care routines. Because reduced care continuity can decrease care quality, Consumer telemedicine providers must apply sound data solutions to maintain adequate and accessible patient records. As more healthcare providers adapt telehealth solutions to their own patients, care continuity will likely increase, lessening the chance that the patients end up at the clinic or urgent care center where they need quick care. Worried about technology's limitations? You're not alone. Many doctors worry about technical problems associated with telemedicine. Many physicians and patients alike still like a personal touch, and not all procedures, even the simple checkups, can be performed digitally. However, in cases where patients can just get in and see their doctors in person, and for many cases that they don't require a physical exam, telehealth can be a good alternative. Healthcare laws, reimbursement policies, and privacy protection rules struggles to keep up with this fast-growing industry. As a healthcare provider, you want to promote best practices when approaching telemedicine. While major developments have been made to telehealth reimbursement over the past couple of years, it is still a common stumbling block for providers interested in telemedicine. It is best to do little research to the reimbursement policy landscape before you get started. So what do the HIT leaders think of telemedicine? Well, telehealth market is booming and expected to expand to over 30 billion globally by 2020, according to Motor Intelligence Research. Telemedicine has been around for decades, so why has it only recently experienced faster growth, adaptation, and interest? Well, there are four main drivers why telemedicine is booming. As healthcare continues to shift from transaction-based to value-based, health systems have adopted a triple aim, or as defined by the Institute of Healthcare Improvement, the simultaneous pursuit of improving patient care experience while improving health population at a lower cost. This shift to accountability, cost efficiency, population health, and care experience is driving a rapid adaptation to telehealth across the healthcare industry. In a recent study, surveyed 2,000 plus primary care physicians and found that 57% of them are willing to conduct telehealth video visits. Why? Work-life balances was the most popular reason for seeing patients by means of video, followed by increased earning opportunity and improved patient outcomes. The growth of on-demand healthcare is not only increasing physician access and driving down costs, but it also creates opportunities for technology companies to provide faster, more convenient, customized user experience, resulting in improved outcomes and enhanced overall patient experience. Legislation is starting to address barriers in telehealth by focusing on three primary policy areas: coverage and reimbursement, licensure, and safety and security.
The Future of Telemedicine by Makita Bird. Advances in healthcare and telecommunications, as well as electronic devices, have made significant strides over the years. Even with these great advances, telemedicine is not commonly used in most medical practices. Some of the reasoning behind this is that people want to see their doctors in person. They may not understand telemedicine or know how to use different computer devices to even log in to access telemedicine. And they don't know telemedicine is an option for them. Even with these obstacles and others that's preventing telemedicine to be used daily, a study in 2016 showed that 15 million patients were assisted remotely through the use of telemedicine. Another study shows that by 2018, 7 million patients will be accessing telemedicine. The next generation of physicians started using smartphones, Skype, FaceTime, and other social media outlets and electronic devices as early as high school or even earlier. With this being said, most current medical students state that they feel like telemedicine is the next natural step in healthcare. They also feel that their patients are similar to them with using these electronic devices, and that they will be able to build a meaningful doctor-patient relationship even through telemedicine. Telemedicine has shown great value over the years. A study shows that $4,500 was saved when using telemedicine to treat patients versus using a telephone consult for a pediatric case in Royal Hospitals. So telemedicine saves more money per instance. Also, using telemedicine led to a 31% decrease in patient transfers, including expensive air ambulance transfers. For example, if a patient is in need of a specialist but cannot get to that specialist, a telemedicine appointment can happen where that specialist can view, speak with, and examine to a certain extent that patient through telemedicine versus that patient being transferred to the location where the specialist is. Who benefits from telemedicine? Parents of small children. Since it is very common for small children to get sick, relying on an in-person visit every time your child comes down with a routine infection can lead to multiple days off work and school. With the advances of telemedicine, sick children and their parents can have a very convenient medical appointment with their healthcare provider. So the parent doesn't have to miss several days of work, and the child can recover and no longer miss school. Also benefiting from telemedicine are older adults and elderly individuals. This is the case because some elderly or aging individuals may have difficulties with mobility, driving, and things of that nature. So having a telemedicine appointment is much more convenient than trying to get to their medical provider in person. Also, individuals who benefit from telemedicine are people who live in rural communities. If a person lives 2 hours plus from their medical provider, going in for a routine visit or for something small or minor, having a telemedicine appointment is much more convenient and time saving. Benefits to healthcare providers. Telemedicine also has great benefits for providers and medical facilities. Some of these benefits are reduced cancellations. Patients will be less likely to cancel their appointments if they simply have to log onto their smartphone or computer to attend their appointment. Expanded patient base, which can lead to increased revenue streams. Since telemedicine offers physicians the opportunity to reach people that otherwise wouldn't have access to them, this can increase the volume of patients that these physicians see, which can in turn increase the revenue and reduce absenteeism. If a medical provider simply has to log onto their computer to attend work, they will likely come to work when needed and not be absent or take off as much. Telemedicine has proven its value over the years, displayed many benefits, and continues to show its importance to the delivery of healthcare. Telemedicine allows for healthcare providers to diagnose, evaluate, and communicate to patients through telecommunications, specifically smartphones. Not only is telemedicine convenient, but it also reduces the workload of the healthcare provider and reduces office visits, saving money for copays and transportation costs. Overall, telemedicine is a hit solution that is very important to patients and healthcare providers and the overall delivery of healthcare.